Nasal packing is the placement of gauze or other material inside the nasal cavity after a surgical procedure like rhinoplasty to control bleeding, prevent infection, and support the healing process. There are two main types of nasal packing: anterior packing, which is placed in the front of the nostrils, and posterior packing, which is placed in the back of the nasal cavity. Nasal splints are devices placed inside the nose after a rhinoplasty to help maintain its new shape, increase comfort, and reduce swelling. They are typically made of soft silicone or plastic material. Nasal packing and splints are usually removed within a week after rhinoplasty surgery. Your doctor will determine the best time for removal based on your individual healing progress. After nasal packing and splints are removed, you may experience some discomfort, mild pain, and difficulty breathing through your nose. These symptoms should gradually improve over the next few days. Monitoring the patient's vital signs, such as heart rate, blood pressure, and oxygen levels, is critical to ensure a safe recovery room after rhinoplasty surgery. The recovery room team needs to closely monitor the patient's level of consciousness and ensure that the effects of anesthesia are wearing off gradually. Pain management for rhinoplasty patients in recovery is essential, with frequent assessment and evaluation of pain levels to determine the most effective medication dosage and timing. Proper hygiene such as hand washing, disinfecting equipment, and wound care is important for preventing infections in the recovery room. The recovery team must be prepared to identify and address any complications that may arise, such as bleeding, swelling, or respiratory distress. Effective pain management is essential following a rhinoplasty procedure. Patients are often prescribed opioid pain medications such as oxycodone or hydrocodone following the surgery. Other medications such as ibuprofen and acetaminophen can also be used to manage pain and reduce swelling. There is a small but real risk of opioid addiction following rhinoplasty surgery, especially for patients who have a history of substance abuse. It is important to talk to your surgeon before the procedure about your pain management options and your medical history. Regular check-ins help ensure proper healing and identify any potential issues. Typically scheduled within the first week after surgery to remove packing and assess healing progress. Scheduled around 1 to 2 weeks after surgery to remove sutures and assess healing progress. Scheduled around 2 to 3 weeks after surgery to assess healing progress and discuss any concerns or questions. Scheduled around 1 to 2 months after surgery to assess final results and discuss any further care or concerns. All surgeries carry risks. Excessive bleeding can lead to complications. Infection can occur during or after surgery. Anesthesia can cause complications in some cases. Follow your post-op instructions to minimize risks. Swelling is a common side effect of rhinoplasty. It may last for several weeks, but eventually subsides. Bruising around the eyes and nose area is common after rhinoplasty. It generally resolves within 1 to 2 weeks. Asymmetry may arise during or after rhinoplasty if it's not performed by a skilled surgeon. Revision surgery may be required. In some cases, rhinoplasty may cause temporary airway obstruction or breathing difficulties. These issues generally resolve as the nasal swelling goes down. While serious complications are rare, they can include infection, bleeding, or adverse reaction to anesthesia. It's important to discuss all risks with a qualified surgeon. Swelling is a common side effect of rhinoplasty and can last for several weeks. Bruising around the nose and eyes is also common after rhinoplasty and can take up to 2 weeks to resolve. There is a risk of asymmetry after rhinoplasty, which may require revision surgery to correct. In rare cases, rhinoplasty may cause breathing difficulties. This is more likely to occur when the surgery is performed on the septum or turbinates. It is important to follow all post-operative instructions and attend all follow-up appointments with your surgeon to ensure proper healing and minimize the risk of complications. Rhinoplasty is a cosmetic surgical procedure to enhance the appearance and proportion of the nose. 1. Incisions are made. 2. Reshaping of the nose. 3. Closing the incisions. Bruising and swelling will last for several days, and patients should avoid any strenuous exercise. Bleeding, infection, or an adverse reaction to anesthesia, etc., are potential rhinoplasty risks. A skilled and experienced surgeon can offer excellent results with a rhinoplasty procedure. providing improved facial harmony. We appreciate your support. Stay up to date with our latest videos. Never miss out on new content. We can't wait to share more with you.